Cancer remains one of the most formidable health challenges globally. Researchers and doctors constantly seek innovative and effective treatments. One such advancement gaining prominence is thermal ablation. This technique represents a significant step forward in how we approach certain types of cancer. It offers a targeted way to destroy tumor cells directly within the body. This approach is often less invasive than conventional surgery. Thermal ablation is emerging as a powerful tool in the oncologist's arsenal. It provides a minimally invasive alternative for patients who might not be suitable candidates for surgery. The core principle of thermal ablation involves using extreme temperatures. These temperatures, either very hot or very cold, are precisely delivered to the cancerous tissue. This focused energy effectively cooks or freezes the tumor cells, leading to their destruction. Initially used for smaller tumors or in specific organs like the liver, its applications are growing. Doctors are now exploring its use in treating cancers of the lung, kidney, bone, and even the prostate. As technology continues to advance, the precision and efficacy of thermal ablation techniques are expected to improve even further. This offers hope to many patients looking for effective and less burdensome cancer treatments in the years to come. Thermal ablation works on a straightforward yet powerful principle. Extreme temperatures kill cells. Cancer cells, like all living cells, cannot survive when exposed to temperatures far outside their normal range. Thermal ablation techniques harness this vulnerability. They deliver either intense heat or extreme cold directly to the tumor. The process typically involves inserting a special needle-like probe into the tumor. This is often done under imaging guidance, such as ultrasound, kinetic scan, or MRI. These imaging techniques allow the doctor to see the tumor and accurately place the probe. Once the probe is correctly positioned within the cancerous tissue, it delivers the thermal energy. If heat is used, the temperature at the probe's tip can rise above 60 degrees Celsius, or 140 degrees Fahrenheit. If cold is used, temperatures can drop well below -40 degrees Celsius, or -40 degrees Fahrenheit, freezing the cells solid. When cells are heated rapidly, their proteins denature and their membranes rupture. When cells are frozen, ice crystals form both inside and outside the cells. The body's immune system then gradually removes these dead cells. The goal is to create an ablation zone that encompasses the entire tumor plus a small margin of surrounding tissue. Precise control over the temperature and the duration of exposure is crucial for achieving this outcome while sparing healthy nearby structures. Heat-based thermal ablation techniques are among the most commonly used. Two prominent methods in this category are radiofrequency ablation, or RFA, and microwave ablation, or MWA. Both use electromagnetic energy to generate heat within the tumor tissue. However, they differ in the frequencies they use and how they create this heat. RFA has been around longer and is well established for certain cancers. MWA is a newer technology that offers some potential advantages in specific situations. Radiofrequency ablation, or RFA, uses high-frequency electrical currents. These currents are in the radio frequency range, similar to radio waves. A probe with tiny electrodes at its tip is inserted into the tumor. When the current is passed through these electrodes, it agitates ions in the surrounding tissue. This ionic agitation creates frictional heat. Microwave ablation, or MWA, uses electromagnetic waves in the microwave frequency spectrum. The MWA probe acts like an antenna, emitting microwaves into the tumor. Doctors choose between RFA and MWA based on tumor size, location, and proximity to vital structures. While some thermal ablation techniques use heat, others employ extreme cold. Cryoablation, also known as cryotherapy or cryosurgery, is the primary cold-based method. It works by freezing cancer cells to death. This technique has been used for decades for various conditions. Its application in treating internal tumors has become more sophisticated with advancements in imaging and probe technology. Cryoablation offers a different mechanism of cell destruction compared to heat-based methods. The cryoablation procedure involves inserting one or more thin probes, called cryoprobes, into the tumor. These probes are cooled by circulating a cryogen, typically argon gas, through them. As the gas expands at the tip of the probe, it causes a rapid and significant drop in temperature. This creates an ice ball of frozen tissue around the probe tip. The goal is to engulf the entire tumor within this ice ball. Doctors carefully monitor the formation of the ice ball using imaging techniques like ultrasound or CT. The freezing process can also disrupt the small blood vessels that supply the tumor, cutting off its oxygen and nutrient supply. Cryoablation is generally less painful than heat-based ablation during and immediately after the procedure. Section 5. Strategic strikes. When doctors choose thermal ablation. Thermal ablation is not a universal solution for all cancers. However, it is a highly effective option in specific situations. Doctors consider many factors before recommending this treatment. These include the type and stage of the cancer. The size, number, and location of the tumors are also crucial. The patient's overall health and their ability to undergo other treatments like surgery play a significant role. Thermal ablation is often chosen for patients with localized tumors that have not spread extensively throughout the body. One common application is for primary liver cancer, such as hepatocellular carcinoma. It is also used for liver metastases, which are cancers that have spread to the liver from other parts of the body, like the colon. Similarly, it is used for kidney cancer, especially for smaller renal tumors, typically less than 4 centimeters. Lung cancer is another area where thermal ablation is increasingly utilized. Section 6. Getting ready. Patient preparation for thermal ablation. Proper preparation is essential for a successful thermal ablation procedure and a smooth recovery. The process begins well before the day of the treatment. It starts with a detailed consultation with the interventional radiologist or the specialist who will perform the procedure. During this consultation, the doctor will explain the procedure, its benefits, risks, and alternatives. They will review the patient's medical history, including any allergies, current medications, and previous treatments. Several tests are usually required before thermal ablation. Blood tests are common to check kidney function, liver function, and blood clotting ability. Imaging studies such as CT scans, MRI, or ultrasound are crucial. These images help the doctor precisely plan the procedure, determining the best approach to reach the tumor and the extent of ablation needed. Patients will receive specific instructions regarding medications. Fasting is also typically required. On the day of the procedure, patients should arrange for someone to drive them home. Section 7. Inside the procedure room. What to expect during thermal ablation. On the day of the thermal ablation, patients are typically admitted to the hospital or an outpatient interventional radiology suite. The medical team, including nurses and technicians, will help the patient get ready. An intravenous line will be placed in an arm or hand. This IV line is used to administer fluids, medications, and, if needed, contrast dye for imaging. Monitoring equipment will be attached to track vital signs such as heart rate, blood pressure, and oxygen levels throughout the procedure. The type of anesthesia used depends on the location and size of the tumor, as well as the patient's overall health. For some procedures, conscious sedation, also called twilight sleep, may be sufficient. For other, more complex ablations, general anesthesia might be necessary where the patient is completely asleep. Using imaging guidance such as ultrasound, Connecticut, or MRI, the interventional radiologist carefully inserts the thin, needle-like ablation probe through the skin. Once the probe is correctly positioned, the ablation process begins. Section 8. Weighing the options, benefits, and risks of thermal ablation. Thermal ablation offers several significant benefits, making it an attractive option for many cancer patients. One of the primary advantages is its minimally invasive nature. Unlike traditional open surgery, thermal ablation usually involves only a small skin puncture for the probe insertion. This means less pain, reduced blood loss, and a much smaller scar. Consequently, recovery times are generally shorter. Many patients can go home the same day or after a short hospital stay. Another key benefit is its ability to target tumors precisely. Advanced imaging techniques guide the probe directly into the cancerous tissue. For patients who are not suitable candidates for surgery due to age, other medical conditions, or tumor location, thermal ablation can offer a viable treatment alternative. However, like any medical procedure, thermal ablation carries certain risks and potential side effects. Pain or discomfort at the probe insertion site is common but usually manageable with medication. Section 9. Looking ahead. The current limitations and future of thermal ablation. While thermal ablation is a valuable and evolving cancer treatment, it does have limitations. It is generally most effective for smaller tumors, typically those less than 3 to 5 centimeters in diameter. Larger tumors are more challenging to ablate completely in a single session. The number of tumors that can be treated effectively in one session is also limited. The location of the tumor plays a critical role in determining suitability for thermal ablation. Tumors situated very close to major blood vessels can be problematic. Conversely, tumors near delicate structures such as major nerves, the bowel, or the diaphragm may carry a higher risk of collateral damage. Despite these limitations, the future of thermal ablation looks promising. Ongoing research is focused on improving the technology and exploring ways to combine thermal ablation with other treatments.